Hi, I'm Alyssa,
I'm Bailey. And I'm Carly.
and this is our community education project. We chose the influenza as the disease that affects our community, and we chose to educate people on it because we feel as though the flu is really just misunderstood. So, one of the inspirations for choosing this was for me a couple years ago. I had a friend get her flu shot, and she told me it didn't work because a week later she was throwing up and had all sorts of gastrointestinal problems. And I realized that's when I realized that a lot of people still think that influenza or the flu means stomach flu, and it doesn't. So we created this poster to distribute to the community and put in kind of high traffic areas and in areas where people are at risk and maybe where education may not be quality. So we tried to make this poster to help educate people on what the flu is, and how can we stop it, and how can we protect those who are the most vulnerable. So again, we chose the medium of a flyer. It's a double-sided flyer. We intend to print it out and put it like in nursing homes, in high trafficked areas like in a Starbucks. I know I'm gonna put some at my church and in just kind of different areas and at St. Mary's, where people can grab it and it's an easy read, not too medical, hopefully, and just get some information on it. So here's our front. It says, just right off the bat, we talk about the symptoms of the flu. I'm going to have Bailey talk about that later because we go into more detail on the other side. But again, we have the definition here, just what influenza is: a virus that affects the nose, lungs, and throat. And then we go into just how to fight it. So if you do contract it, there are treatments available, which not many people know about. Tamiflu is a really good, effective treatment, but it must be taken within 48 hours of symptoms. So we really want people to know that because we don't want them to wait if it gets to be too bad. We want them to get help. So the Tamiflu shortens the severity of symptoms and how long that they have the flu. But we want to encourage people, if your symptoms are mild, to stay home, drink fluids, and take over-the-counter medications like Tylenol or Advil for their fever. And then right here, again, just right on the front, we wanted to showcase that your best defense really is to get the flu shot every year and to wash your hands, especially before eating or touching your face, and to clean frequently touched surfaces. So again, this is kind of just our front page, and on the back, hopefully we've caught people's attention at this point that encourages them to go into the back. And on the back side, we have a lot more details. So I'm gonna let Bailey show us her side or her section.
Okay, so as Alyssa stated, distinguishing these common colds versus the flu is kind of difficult, and a lot of people have these misconceptions about them. I know that my family actually still refers to the flu as the stomach flu. So I grew up with thinking that just the simple flu was the stomach bug, and then a cold was a cold. So that it's really important to identify the difference between the two, because the severities are a lot different, or can be a lot different. So with the common cold and the flu, they're caused by two completely sets of viruses. So the common cold can be caused from the rhinoviruses, from various rhinoviruses. And then with the flu, it's caused by various influenza viruses. And with the flu, you're going to get a really distinguishing things such as a severe onset of fever. And when I say severe fever, I'm talking like 102 to 106. So that's usually how the flu starts off. And the flu is more in the respiratory system versus the common cold. Depending on where it lands in your respiratory system, you're going to have some sneezing and a lot of dry coughs. And with the flu, you're going to have symptoms such as achiness, fatigue. You're going to have possible joint aches. You're just not going to have an appetite. You're going to feel crummy all over. And with a common cold, you're going to have just a gradual, really slow onset. You could start feeling tired, but one of the first signs of the common cold is actually an itchy or a scratchy throat. And feeling tired can accompany that as well. But with a common cold, it's mainly in your head versus the respiratory tract like the flu is. So that's why the flu is a lot more serious than the common cold, is because it gets in your lungs. With the common cold, it's going to stay in your head and really just affect your head and your nose overall. You can have sore throat, a mild headache, and usually within a week, it's gone. Whereas the flu, it can last longer than the common cold. It can last up to 2 to 3 weeks. And with the flu, after you have that dry cough and you start to feel better, you can actually start to feel worse. And the fever can actually come back and peak as well. You can start to feel exhausted again. So that's one really distinguishing factor between the two, as well as the severity of the symptoms, such as the fever. With a common cold, you can have like a low-grade fever, and when I say that, I'm talking about 99 to 101 degrees. And okay, so let's talk about when we should seek medical care. So if you develop shortness of breath, or you're just having troubles breathing in general, or you have any kind of chest pain accompanied by the cold or the flu, you should definitely seek medical care. Any kind of cough or mucus coming up that's kind of green and abnormal colored, yes, you should probably seek medical attention. And then if you're taking Tylenol for your fever or Motrin, anything to help reduce your fever and it's not cutting it, you want to seek medical attention. And one more thing that you should go to the emergency care for is dehydration. That's a huge factor. And the way you can tell at home is that you're not urinating as much. And that's it for my part. Thank you.
Okay, so looking at the flu shot information section. So as Alyssa stated, you should be getting the flu shot every year, but who does that include? So basically, infants 6 months and older should be vaccinated every year. Children between 6 months and 8 years of age should get 2 doses of the vaccination. There's also for high risk, so typically it's going to be your elderly, 65 and older. There is a high dose flu vaccine for that age group. Flu shots are safe for women that are pregnant, any stage of pregnancy also. And then everybody else is just going to require a single dose. So I know that getting a shot can be scary, but you know, here's a few more reasons why you should get a flu shot. It takes about 2 weeks to develop. It does peak around the winter time. So you want to make sure that it's in your system before the flu season is hitting, so that you do have the immunity built up in your system. Okay, so you typically want to get your flu shot maybe around October is whenever you're going to see a lot of clinics advertising it. You'll see posters, flyers everywhere. And a new vaccine, comes out every season. So a little facts for you to know about the flu vaccination. Like I said, a new one comes out every year, and it's typically going to protect against 3 or 4 different viruses. So there is a few that do come out, so you do want to make sure you get that flu shot. If you do happen to get the flu, having the flu shot in your system will help lessen some of the symptoms. Also, if you do get the flu shot, you are reducing your chances of getting the flu by 40 to 60%. So it is really vital that you do get it. And also, it also helps prevent from spreading it. So the term is called shedding, but in other words, you won't spread it to other people. I have also listed a few centers that do free flu shots. So some free clinics to look at. You have the Stockton Health Center and Kaiser Permanente. Those are just a few. The contact information is all listed on there, easy to reach. Go get that flu shot for free. And then also, if you look over to the left, dialing 211 in the San Joaquin County will give you access to family resources and a referral center. So they'll be able to refer you to a free clinic in your area. And all of that is listed on the flyer for you, easy to access. Go get your flu shot. And thank you for watching our presentation on the flu shot.
Yes, thank you so much. We really hope that something like this can be spread as something like this, as in the poster, not the flu, can be spread into the community, the education on it, because we feel like the flu is really misunderstood, and even the flu shot itself is really misunderstood. And so education, knowledge is power, and so getting this information into people's hands is really important to help kind of bust some of the myths that surround the flu and the flu shot. And the more people who get the flu shot and the more people who are protected against the flu, it only benefits those who cannot get the flu shot and those who are most at risk. And so we just want to encourage people to become informed and to be empowered to make some changes and hopefully get their flu shot. So thank you. I'm trying to figure out how to stop the recording.